I've organised with a bunch of other great people a community meeting in the Byron Bay Community Centre. We've invited speakers from all over Australia who are experts in their field, the doctors, police and lawyers, community advocates. And we had a full house today, which was fantastic, of local people across all different ages and shapes and sizes, and they've all turned up here to hear these people speak.
The experience of Newcastle looms large in any discussion of community responses to alcohol-related violence and other harms.
And I led more than 150 local residents, small business, concerned citizens and doctors in Newcastle support a police campaign, in full credit to the local police, which has led to an internationally unprecedented reduction in alcohol-related violence of at least 37%.
Well, the Byron community, like the Newcastle community, want to adopt an evidence-based approach. And the evidence is unequivocal. In terms of community support, we know that 80% of the community support these simple, modest measures. So the problem's not with the community. The problem is not with the research. The problem is not with the answers. It's the problem with the politicians who are too besotted and beholden to the liquor industry in terms of donations and other support, and they're putting pub and club profits ahead of public safety.
Last Drinks at 12 formed as a result of the community meetings that took place in January and February and March this year, and they all took place as a result of the violence that took place in and around Byron last New Year's Eve.
We're all trying to tackle the same problem, which is violence in Byron Bay. The Accord is trying to tackle it. There's only members, I believe, at the moment that are doing, other than the police, of course, that are continually doing amazing work, that have offered up solutions to the issue at the moment, voluntarily, to try to see a change.
The Byron Bay Liquor Accord and the Last Drinks at 12 have a lot in common. They were both established to regulate and control the behaviour of people fueled by alcohol.
We've put a voluntary set of measures in place, including a 1:30 lockout, no shots at any time, no doubles at any time, no jugs at any time, no RTDs more than 5%. We've also put some bottle shop measures in place. As far as we heard from the community that large goon was an issue, so we did no glass greater than 2 litres available in the town at any time, except for restaurants who are cooking, but not to general public.
And I think both organisations want to do the same thing. I think the difference at the moment is that one group has instituted a trial, which they should be commended for, which is the Byron Bay Liquor Accord, but that is a non-compulsory, non-enforceable set of conditions. They've believed that those conditions are tougher than Newcastle, but the architect of the Newcastle solution has been here and has clearly told us today that they're not.
And there is a silver bullet, and that silver bullet simply is a lack of political will. We need the politicians, we need local politicians, state and federal, to follow the evidence, and that simply is very modest reduction in late trading hours significantly reduces alcohol-related harms. We're not talking about prohibition, but it's established beyond a doubt that very modest reductions in the availability of supply in alcohol have disproportionate improvements in health outcomes.
I think it's crazy to think that young people are going to turn around and say, well, close at 12, go home and don't do anything else. I also fear that maybe we'll push the issue onto the streets, into private parties, and stretch police resources even further by doing that.
The police answered, Tony, and I'd be interested in your answer, they'd rather deal with people 5,000 people at 12 o'clock than 3 o'clock.
I'd have to agree with that. It's far easier to deal with them at midnight than 3 a.m.
If venues do close down, where do people perform? Where do artists go? That's another issue.
The statistics for alcohol-related assaults are alarming, and we predict that almost 8,000 alcohol-related assaults this summer in New South Wales will occur. Over 3,000 of those will be domestic violence. It underlines the fact that victims are often those who do not drink excessively. It's the rest of society, or in the case of domestic violence, spouses and children.
This is just a broken nose. And we see it in a nightclub. One punch. Look at the surgery that goes into fixing this broken nose. The patient goes to the operating theatre. We cut from ear to ear to get to the nose. We start peeling the face down. We get the face down to the nose. We get to the broken nose, titanium plates and screws. This is just a broken nose. These operations can cost up to $36,000 in our hospitals.
This year I've seen 2 occasions, and I've had of situations where I've had young men with their heads full of blood, and we've had to put them on life support, and then eventually that life support's been turned off and we've had to donate their organs to other families.
In the big picture, what's happening is the young people in our community are growing up with a normalised view that, you know, it's okay to be drinking in restaurants, pubs, clubs, nightclubs anytime, on the beach, in the parks. And that's really concerning, because the statistics that perhaps haven't been talked about around early initiation into alcohol consumption are also really high in Byron. About
once a fortnight I have to go to Byron Bay Hospital and I get called in to see someone, and unfortunately I go past and there's often a girl waiting in the waiting room who's just been sexually assaulted or raped. Okay, that's the first thing I just wanted to say. So it's about once a fortnight, and unfortunately I get called in to see other cases and I see her there. And speaking to the sexual assault workers, invariably the girl is intoxicated, and it's after midnight.
And look, I've spoken with OLGR, police, you know, many people, and no one says it's a simple issue. And I think anyone who thinks it is simple, it's not just happening in Byron, it's a society issue.
In Australia's culture, it's a very alcohol culture, and unfortunately it's an alcohol and violence culture, where alcohol and violence go hand in hand.
The legal justice system, that's for another argument. We could go on all day with that, but the figures speak for themselves, that we take the alcohol out, we close earlier, people behave better. It's simple.
It's complex, and anyone says it's not complex would be kidding themselves.